On Friday, the public hearings continued with the testimony of Dr. Shalidra Rajkumar, head of the General Surgery Unit and surgeon attached to the burn care unit at the Georgetown Public Hospital. Dr. Rajkumar recounted receiving a call just before midnight on the fatal night of May 21 from the Director of Medical and Professional Services of the Georgetown Public Hospital, Dr. David Samru, that the fire was in progress and his services were requested. He was instructed to put together a team for burn care, after which he would be joined by emergency room responders to travel to Mahdia. Dr. Rajkumar told the COI that himself and team subsequently arrived at the Eugene F. Correa International Airport, where in a matter of minutes they were placed on an aircraft and flown to the Mahdia airstrip, arriving just around 3 a.m. Equipped with a team and medical supplies, Dr. Rajkumar headed to the Mahdia hospital.
There were people everywhere on the streets in the compound. Luckily, there were not so many within the hospital itself, but there were lots of people lining the streets and within the compound of the hospital.
Welcomed by Dr. Dudnot, Regional Health Officer of Mahdia, Dr. Rajkumar was asked to do a quick overview of the patients at the hospital before returning to the airport, where he was informed that 3 students in a critical condition were awaiting medical evacuation.
There were about a total of about 20 females in the Mahdia hospital. There were about 6 of them that were in the actual treatment area. There was one that was in a separate room, and then the majority of them were in a kind of a restroom for the doctors and nurses. When we examined her, she had burns to the back, both thighs, the left thigh more severe. That was the circumferential, meaning the burn was completely surrounding the thigh, extending below the knee into the leg.
The surgeon diagnosed one of the girls with carbon monoxide poisoning due to smoke inhalation. Upon returning to the airstrip, Dr. Rajkumar concluded that the patients who were on the aircraft to be medically evacuated were not as critical as the others at the hospital. As a result, the patients at the hospital who were in critical condition were evacuated instead.
I boarded the aircraft along with Dr. Torres, and we examined the 3 patients who were being airlifted. Those students were sitting comfortably. None of them were lying. They were not in any crisis or any. They were clinically stable. We decided to have those patients transferred back to the hospital, and we went ahead and prepared these 3 patients that we mentioned just now for the medevac.
Prior, 3 students were taken to the GPHC due to their critical condition. Dr. Rajkumar said despite the limited medical staff at the Mahdia hospital, they did their best given the situation. He also noted that neither an intensive care unit nor an operating theatre were present at the Mahdia hospital. Renata Burnette, reporting for the HGP Nightly News.